Hi, I'm Nena, one of the CANS nurses at Cynthia Gregg, Face and Body Specialist, and I'm excited to welcome you to our presentations on myths and misconceptions in the field of aesthetics. I'll be leading off discussing neuromodulators, and if you have any questions during my presentation, please email them to injectablequestions@cynthiagreggmd.com. So let's start talking about some of the ones related to the neuromodulators. The number one fear that people have is that they're gonna look paralyzed or frozen or fake. And I don't think you should have any concern about that if you come here. We're really good, all of the nurses and physicians, at customizing it and making it particular to what you're looking for. Some people do want no motility and others want to just be softened. So part of our consultation with you is to figure out what your aesthetic goals are so that we can tailor them to you. Another misconception is that it's toxic or poison, particularly Botox, one of the neuromodulators that we've had the longest in the U.S., has over 20 years of a safety track record. We inject that, Xeomin, Daxify, as well as Dysport, and we always get it directly from our certified vendors. There are some concerns about counterfeit Botox on the market now, and you can rest assured that here you will never receive that. So these have a great safety profile, and we've been using them safely for years. Another one is about that it's a permanent effect, and it's not. Good news, if you don't like it, it will go away. The bad news is you're probably going to love it and be wanting to come back for your next treatment. It usually lasts anywhere from 3 to 6 months. That can depend on which product we're using, the location of where we're injecting, and the dose. So every time that you come back in, we're always assessing how long did you last? Did you like it? Do we need to make a dose adjustment? And if you're new to any of the neuromodulators, we always grab a baseline set of photos before we begin. We have you come back at about the 2-week mark. By then, any of the neuromodulators should have kicked in and we're able to assess what results you got. And we can make any tweaking that we need to do at that time. Another misconception is that it's an immediate effect, and some people do kick in as quick as 24 hours. I'm about day 10 for most of mine, and that's why we usually have you come back at that 2-week mark. At 2 weeks, it is what it is, and we can make any changes that need to be done. Another question and a misconception is that it's painful. It is not. Most people say it's like plucking an eyebrow or a mosquito bite. We use very tiny needles. If you are very needle phobic, we're happy to give you some topical numbing cream. We're happy to use ice as well, but most people find it very comfortable, so this should not be a barrier for why you're scared to come in. Another misconception is that it's only for wrinkles. That's certainly our primary thing that we do it for, but it's also approved for migraines. We use it for hyperhidrosis, excessive sweating under the arms, as well as in the hands, the fingertips and palms. We can also do a lot with Botox or any of the neuromodulators with brow shaping. We can lift the medial brow, we can arch the lateral brow, we can help where you pull down the corners of your mouth. So there's all kinds of cool things we can do. The lip flip is something that's very popular now, where we can help evert that lip a bit with just using a neuromodulator. So if you have any questions about those other things, your injector can certainly help you with those. Another question is that it's addictive. If you quit doing it, will it get worse than if you started? And that's not true. We know that if you stop doing it for any reason, sometimes people have pregnancies that weren't expected, so they don't come in for over a year to get treated. But because of the amount of time that we had been injecting them, they really never quite go back to their baseline. So it's helpful, even if you choose to quit doing it for any reason later on. Another misconception is that it's only for women. Men are our fastest growing demographic in the country, and we have a good number of men here in our practice. We're always very mindful with men. We're not going to try to arch that brow. Men should have a flatter brow. They should have a stronger jawline, a stronger chin. So we're very careful about making sure that we never effeminize our men. One of the questions is that if we do Botox, will you not need any facial plastic surgery? And my comment to that is, I wish. We are only helping with dynamic muscle function. So when Dr. Gregg, our facial plastic surgeon, does surgery, she's redraping the tissue. We can certainly help and come in after or before, but we are not going to give you a facelift result. It would be in addition to surgery, not in lieu of surgery. Another myth is that you should wait until you're really old to begin doing the neuromodulators so that you can really get the most bang for your buck, and that's not true either. A lot of people are starting now in their 20s and 30s doing it more as a prevention. If you wait until you're close to 80 and you've got a really deep furrow between your brow, I'll certainly improve it, but I'll never make it as good as if I prevented that crease from occurring to begin with. Oftentimes you don't need to come as frequently, and you don't need as big a dose than as if you wait until you're later. Another concern is that it's too expensive, and typically people see me on average about 3 times a year. Some people are 4, some people are 2, but I think if you planned in your budget that you'd see me 3 times a year, that would be on track for most of our patients. A lot of that again depends on the area we're treating, the dose that we're using, so that's a conversation that we have to make sure that we're meeting not only your aesthetic goals but your financial goals as well. Most people, when they dollar cost average what they're using here in the office for their neuromodulator, come out to be less expensive than over a year what they're using to get their hair cut and colored. So it typically is very affordable, and we certainly are mindful of your budget as well. Botox is the same as fillers, and that's not true. My colleagues Andrea and Megan later on will be discussing more of the myths associated with fillers, but we oftentimes use them together. Fillers help to give back volume. We know as we age, we lose bone, we lose fat, so it's more of a structural lifting, volumizing treatment we do. The neuromodulators, again, are all with dynamic muscle function, particularly in the lower face as we pull down, oftentimes going in and putting filler in strategically north and in the south can help, and then we'll go back behind it and add some neuromodulator to really be the icing on the cake to help with that. A myth is that 10 to 20 units of Botox is enough for your whole face. We certainly use FDA-approved guidelines, but we also have years of experience in this office to determine what's best for you. If you have very strong muscles and are really wanting not to have a lot of motility, we're going to need to dose you higher. So again, we're always customizing, never cookie cutting, and really trying to make sure that we give you the best bang for your buck and that you're happy with what we're doing. I have 2 twins that come see me, and they are completely opposite in how I treat them, both with filler and with Botox. So just knowing what your friend or your mother or daughter does doesn't mean necessarily that that will be your treatment plan. I hope I helped to answer some of your questions and dispel some of the myths. Please stay tuned. The rest of my colleagues are going to be discussing other topics about myths and misconceptions in aesthetics, and I'll hopefully give you a wealth of information. Thank you so much.